Hello, everybody. It's my pleasure to introduce our next chair of the next session on panel discussion on capacity building and cultural next generation patient advocacy leaders, which is really important considering who's going to carry the torch after we're done. So our chair is Carla Diaz Costella. She is a World Patient Alliance founding director. She is also currently the CEO of Esperanza, an advocacy nonprofit organization based in Peru for patients with cancer and other chronic diseases, which is really an important area to look at. So without any further ado, Carla, you want to come? Oh, there she is. Thank you.
Thank you so much, Penny, for the introduction. I'm really delighted to see you all today. Thank you for being here. And let's take seconds, please, to stand up. Who can join me, please stand up for a few seconds. Yeah. I like you to tell you thank you. Thank you for the amazing job you are doing. Thank you for all you are doing for the global healthcare access. So please, an applause for you. Thank you. This, you can continue, please. Yeah. This panel is a discussion of capacity building and cultivating next generation patient advocacy leaders. So how can we ensure sustainability of our advocacy job? Now it's my pleasure to introduce you to Emma Andrews. Emma, please. Emma Andrews, join us. Emma Andrews is Vice President of the Global Patient Advocacy at Pfizer, leading efforts to integrate the patient perspective across the company initiatives. A registered pharmacist, she has over 20 years of experience at Pfizer, alive. Wow. Working in roles like spanning operations, research, and medical affairs. Her work includes developing medical strategies for Latin America and leading global medical affairs for women's health, with a focus on reducing healthcare disparities and advancing healthy equity. Her global perspective is shaped by her upbringing in Uganda and Cote d'Ivoire. Emma holds a doctor in pharmacy for the Massachusetts College of Pharmacists and Healthcare Science. Emma, please join us. Thank you.
Thank you so much, Carla, for that warm introduction. And thank you to the World Patient Alliance organizers. It's indeed an honor to be here today. So I'd like to start by saying that I've heard the word patient centricity discussed here. And I want to say that that's a word that we also really think about at Pfizer. So when I took on this role about 3.5 years ago, my first task in this role as the Vice President of Global Patient Advocacy was really to understand what our colleagues think about patient centricity, what our leaders think about patient centricity, and more important, what patients think about patient centricity. So we set about defining it at Pfizer. But what we quickly realized, we are evidence-based, we went to the literature. It had already been defined in the literature. So it wasn't about defining it, but putting it into context for our colleagues. And I'm really pleased with where we landed because we worked with our colleagues, our leaders, and more important, our patient advisors. We said that patient centricity exists at Pfizer when we listen and learn from the patient perspective, when we act as partners with accountability and integrity to ensure that what we deliver makes sense to patients and those who care for them. I think someone just said here, not for them, without them. So we really believe that because our purpose, the reason we exist as a company, is to bring breakthrough medicines and vaccines that change patients' lives. So what we do is for patients, we need to do it with them. And I tell you all this to say that, it was really important that we establish a global board of advisors, a global board of patient advisors to ensure that we are listening and learning from the patient perspective, to ensure that we are being held accountable. So when we worked with our global board of advisors, we asked them, what is top of mind for you? What is top of mind for your organizations, and what keeps you up at night? And they said, really for us, it's identifying those next generation leaders in patient advocacy and to ensure that patient advocacy organizations have the capacity and needs that they need to be effective. And so why is that important for us? It's important that we have strong patient advocacy organizations because they're that credible bridge between us and patients. They're that credible bridge that when a patient is diagnosed with a life-changing illness, they go to patient advocacy groups to get that really credible information and a support group of how to manage their disease. And that's important to us because those insights are so important for us from the earliest moments of discovery to when a prescription is prescribed anywhere in the world. So with that in mind, when we heard that identifying the next generation leaders, really understanding that, how do we build and upskill patient advocacy groups? Together, we co-created a platform called the Patient Advocacy Leadership Collective that focuses on really the next generation leaders, where we have courses that are curated by independent faculty. We also have a mentor match program. And we also have a platform specifically for Sub-Saharan Africa, where we ensure that we donate our most valuable resource, which is our colleagues, to go and do a time-bound skill volunteering based on the needs of a patient advocacy group. So with that in mind, I'm really looking forward to the conversation we're going to have today. And the questions we're going to be asking ourselves is, how can patient advocates level up their skills to meet the challenges of our changing world, which is the theme of the conference? And also, what skills are needed to equip the patient advocacy leaders of tomorrow, that next generation? And how can organizations effectively tell their stories in today's current media landscape? So these are the questions that not only the Patient Advocacy Leadership Collective aims to address, but also my panelists, who I invite to stage right now, Regina, Farida, Aviva. I'm really looking forward to the conversation we're going to have that will help answer these questions. So thank you. So thank you so much. And I want this to be a really candid and fun conversation, because I know we're in between you and lunch, but we'll try and make this as lively and as really informal as we can. So I'd like to start by asking my panelists to briefly introduce themselves, but really importantly, tell us their why. Why is this work important? And perhaps, Regina, I can start with you.
Thank you very much, Emma. Regina, once again, Executive Director for Community Health and Information Network. And Community Health and Information Network is a nonprofit organization that engages and empowers patients, family, community through a community engagement model, ensuring that community-owned resources, that is the political leaders, the religious leaders, the cultural leaders, the community health workers, teachers, and the schools all participate. They engage and empowered through health literacy to make sure that they're able to prevent diseases, they're able to seek early diagnosis and treatment, but most of all, when they get information, they're able to process it, act upon it, and make informed decisions, but also navigate the complex healthcare system. So Chain has been doing this for over 20 years. And I'm glad that we have registered many successes, as you've heard from David today. In Uganda, actually, I'm codenamed Patient Safety. Those who don't know my name as Regina will call me Patient Safety. Something that stems from personal experiences of patient safety incidents, family, and the community where I work, and I see incidents of preventable harm happening on a day-to-day basis. And my commitment is to ensure that I make contribution to ensure that we mitigate that harm, working with all key stakeholders.
Thank you, Regina Webalenyo-Nyabo. And with that, I'd like to maybe ask Aviva to tell us what's your why and briefly introduce yourself as well before that.
Thank you so much, Emma. It's great to be here with all of you. I lead reputation communications for Pfizer. So that means that I'm a storyteller. And I'm so happy to hear the extent to which we've all been acknowledging the importance of patient stories, but also the stories of our advocates and our advocacy organizations. Who here, with maybe a raise of hands, has heard the saying, "It's not what you say, it's how you say it"? Okay, great. So we're halfway there, because I like to think of the next piece of that. It's not what you say, it's what they hear. It's about thinking of who you're talking to. Who is your audience? And that audience-centered storytelling is what I really think is so important for capacity building for our advocacy groups. Are you talking to patients? Are they patients with access or without access? Are you talking to industry? Are you talking to your partners? Are you talking to regulators? Because understanding that difference will change the message. And for the importance of patient stories, I just want us to reflect on an example of two patients. Think about two patients who are smokers, and they both are experiencing complications of their smoking. And they go to two different doctors. And one doctor hands the first patient a pamphlet with some statistics about the harmful effects of smoking and sends him on his way. And the other doctor says, "Let me tell you a story. Let me tell you a story about my wife's brother who was a smoker, started taking this medicine, ran a marathon last week, and has a better relationship with his family because of what he was able to overcome." Which patient do you think will have the greater patient outcome? The second one, absolutely. And that is the power of stories when it comes to health. And I'm so happy that the Patient Advocacy Leadership Collective is working to provide those skills that we need.
Thank you so much, Aviva. And Farida?
Thank you,
Same
Emma.
thing. Briefly introduce yourself and tell us your why.
Thank you, Emma. So my name is Farida Mwatia, and I'm based in Nairobi, Kenya. I am the Patient Advocacy Manager for Sub-Saharan Africa at Pfizer. So for us at Pfizer, the patient is at the heart of everything we do. And we do recognize that this season and in this time, the healthcare space has really changed, and the patient needs to be at the forefront of the conversations around their disease management and the outcomes for their journey along the patient journey. So for us, the mission is to ensure that the patient has a place at the table where they are shaping healthcare policies and healthcare discussions, where healthcare discussions are being had, that they're there. And the vision for us is that in the future, patients are not only beneficiaries of innovations, but also co-creators of these innovations. And so that is what I do in a day. And I do partner with patient advocates because you are the link for us at Pfizer with the patients.
Thank you so much, Farida. And reflecting on what we all aspire to be, to make sure that patients are at the center of everything we do. So we also reflect on the state of patient advocacy today. What do you see as the greatest opportunity, but also the greatest challenge for advocacy organizations? Regina, perhaps we can start with you.
Thank you very much, Emma. For me, the greatest opportunity is trust. Building trust takes time, but it's one of the best gifts you can have. So patient advocates are trusted. And because they're trusted, they need to be empowered as well to be able to support the people that they work for in the community. And especially now that we have the technological advancements in different ways, again, it's important that it's not only to have that they should have the trust, but they should be able to empower themselves using the opportunities therein in the technological advancements to be able to support the patients better. You also asked about the challenge?
Yeah, with challenge. Yeah.
Yeah, obviously, the challenge for me is the navigating the healthcare policy environment. To be honest, it's very complex. We also heard from David, the policy environment is very, very difficult to navigate. And it comes a lot with a lot of, political climates. On the other hand, you have the patients with a very limited funding that impacts their ability to even being able to do what they're supposed to do. The diverse patient needs all impact. So it's really difficult to see how to balance within that dynamics and be able to come out successfully. But it's just, like I said, fortitude, resilience, character, and not giving up.
Thank you so much, Regina. And perhaps Fareed, I can ask you the same question, opportunities and challenges for patient advocacy organizations.
So as co-creators of innovation, we continuously engage with patient groups and patient advocates and patients themselves to be able to understand the pain points that they go through or the areas of opportunities or collaboration. So through this co-creation, we are able to come up with innovations that are not only what we imagine the patient needs, but more what they have told us they need. And so some of the challenges that we have found so far, or we have heard from you as the patient advocates, is that capacity building has been a pain point, and also access to information and training has been another area where you would need us to step in. And so these are areas where we have continuously engaged with different stakeholders across sub-Saharan Africa to identify opportunities where we can synergize and create innovations that are useful to patients.
Thank you so much, Fareed. And Aviva?
Yeah, that's great. I want to jump on Regina's idea of trust a lot, because being the trusted source of a story, I think, can make all the difference. Every patient advocacy group, every patient, every business, every nonprofit has a story to tell. They have a worldview and they have a call to action. Is it join our listserv? Is it attend a support group? Is it donate money? And we're all competing for people's very limited attention. Everybody is in an information overload right now, and their time is so valuable. So it's about breaking through the noise. And there are some storytelling skills that I hope that we'll get to that will help patients and advocates break through that noise. The second component is misinformation and disinformation. It has become a huge public health concern lately. It has misleading claims about vaccines and medication have led to a distrust of our public health systems. It has led to an increase in anti-vaccination sentiment, a resurgence of some preventable diseases in some cases. And that is also a big challenge that advocacy groups are up against. One way to address misinformation, part of that is on our technology platforms to do greater social media content moderation, but part of that is for greater, more accessible, understandable, health literate information for everybody. And I think advocates and industry leaders, health systems play a big part of that. And that's, I think, a great opportunity to continue to be that trusted source and build trust in accurate information.
Thank you so much, Aviva. I think trust is really a really strong pillar, because really without trust, you can't really do much. So Farida, perhaps I can switch gears and ask you, give us examples of how Pfizer is collaborating with patient advocates to address some of these challenges. And can you share some specific examples from this region?
In the last a few months ago, we had an engagement with an organization called A Fresh Chapter. A Fresh Chapter is an organization that's not only supporting patients in the US around management of the patient journey for a patient who has just been diagnosed with cancer. So we worked with them in the outreach of patients within East Africa and West Africa for underprivileged patients who have just been diagnosed with cancer. Another area of collaboration has been just this month with the Cancer Association of South Africa, where we have collaborated with them around an outreach program for educating patients around early diagnosis, importance of early diagnosis, and importance of self-examination for breast cancer. The other area finally is around This is Living with Cancer app, and Regina did mention the importance of digital. So as Pfizer, we have worked with patient groups and patient organizations to develop a patient app developed by patients themselves. So this app has been launched in several countries in sub-Saharan Africa. The app itself supports patients through their journey of diagnosis, managing their symptoms, just calendarizing the dates when you have to see your healthcare providers, just being present in the day-to-day activities of living with cancer. And we have received feedback from patients so far on the changes they would like to see or the areas that they think are very useful. And of importance has been the patient advocates themselves, because these are the links that will be able to channel this information to the patients to make it useful from their end. And as it said, we are all patients at one point or another, and we are all one diagnosis away from being a patient. So this is the work that we've been able to do so far to address some challenges around sub-Saharan Africa. And we are looking to hear more from you around what you think we can do and how much more we can support you in the work that you're doing.
Thank you so much, Farida, and for really raising that really big sort of like our North Star, saying that, we need to co-create solutions. We can't assume that we know that what patients need, but that we work together to really create solutions. And with that in mind, Regina, perhaps I can turn with you and for you to tell us from a patient perspective, what do you think the opportunity for the Patient Advocacy Leadership Collective presents for identifying and cultivating the next generation leaders?
Yeah, thank you very much. First of all, I want to say that the Leadership Collective was based on the insights of the patients from the grassroots level, the global patient leaders that are involved in work, and they know the real needs of the patient. And as such, it was designed to meet the needs of the patient advocates, because I'm sure all of us here acknowledge the fact that many patient advocacy groups lack the capacity to effectively run the organizations. They have several challenges, organizational challenges, fundraising, and many others, financial literacy and many others. So this resource was meant to ensure that for us, the challenges that we went through shouldn't be the same challenges that the new generation should go through. Hence, the tool to help them address those needs. So I just want to encourage the patient advocates to make use of this tool and use it to optimize, because these courses are several. They span from leadership, social media, managing organizations, and many others. And they're being offered by prestigious universities. So, and I want to appeal specifically for patient advocates from Africa. I know we have technological challenges. Sometimes even the literacy to be able to access could be challenging, but let's take advantage of this opportunity so that we can be empowered to advocate for our patients even better.
Thank you so much, Regina, and for really saying that, again, not only was this solution co-created with our Global Board of Patient Advisors, but the courses were curated by independent faculty based on the needs of patients and not from what we think as industry. And with that, Aviva, maybe I can turn it up to you to really tell us, what PALC offers members leadership development courses, as well as the Clear AI health literacy tool. But what is the role of communications and storytelling? You alluded to it a little bit in patient advocacy. Perhaps you can build up on that.
Yeah, absolutely. I think the role of storytelling in patient advocacy is the difference between achieving your objectives, reaching your patient groups, reaching your audiences, and not. I wanted to share a specific example that I thought was so interesting. We all in this room know about the importance of and safety of vaccinations. And a lot of the vaccine advocacy groups, they currently rely on statistics to get the message across. Taking this vaccine will make you X% more likely to withstand this virus, or X% more likely to, less likely to, be infected. And so they did a study in the United Kingdom where they asked 500 mothers, 500 women who were pregnant, before they began the experiment, how likely are you to vaccinate your child? And then they presented them with a series of statistics that demonstrated that the probability of their child getting a vaccine preventable disease was much greater than the risk of a negative impact from the disease. And then they asked them again, how likely are you to vaccinate your child? There was no statistical difference in whether or not that mother responded that they are going to vaccinate their child. A second group, they asked the moms the same question, and then they played a video of a mom telling the story of their child who contracted that illness. The mom talked about how much pain the child is in. The mom talked about her hardship getting access to care. The mom talked about how she wished that she had more and different information. And then they asked the mother again, how likely are you to vaccinate your child? The mothers were 40% more likely to vaccinate their children. And that is an extremely significant learning. And that is that stories, more than statistics, have the power to inspire patients to action. And so what we're doing with Clear AI and the Patient Advocacy Leadership Collective is offering those tools to help people understand how to do that. And we're using technology to help make it easier. Clear AI actually allows you the opportunity to upload information that might be, using scientific jargon or not easy for your average patient to understand, and allows them to then get language that will resonate with their audience. And it's so important because we can see impact on patients like we saw in that one example.
Thank you so much, Aviva. And actually, I think someone in the previous session said how sometimes it's so complex. The regulatory documents are so complex. That's where Clear AI, which is clear artificial, they uses artificial intelligence to give us a clear, more almost like a health literacy perspective to really answer complex text. So you can upload that information and it spits it out following health literacy principles that make it easier for anyone to really understand and lead to patient activation. So I think that's really a good tool to have. And perhaps to close, because I know we're going to be running out of time and I'd like to maybe open up the floor for questions, perhaps I can ask each of my panelists, what is one piece of advice or tip you can offer an advocate looking to support patients, and in the theme of this conference so aptly describes a changing world? So what's that one piece of advice? And perhaps Farida, I'll start with you.
There's an African saying that if you want to go fast, you go alone. But if you want to go far, you go with others, right? And so for me, the message I would give is that there are many organizations, many stakeholders, as all of us in this room, that are looking to change the way the patient's experience looks like in the future. We had Boitumelo's story. And for me, what stood out is her diagnosis journey, where she was asking, what is chemo? What is chemo? Why am I getting it? How is my body going to react to this? Let's come together in our own different capacities. In the places that we sit, let's make a change. Because today we are on this side of the divide, but in the future, you don't know, you could be on the other side of the divide, where you're now the patient asking the question, what is chemo? What will it do to me? How can where do I go? Who do I see? And therefore, we all have a role to play in our different capacities. And I also urge you, as Regina has said, if you're a patient advocate from Sub-Saharan Africa or from Africa, please do take the time to download the PALC and get to take advantage of the tools that are therein. Thank you.
Thank you so much, Farida. And just for a plug, we'll have a table set outside where you can quickly access, and we'll be giving out information on Patient Advocacy Leadership Collective. But Regina, perhaps over to you. What is that one piece of advice or tip you can offer an advocate?
I think the advice I'd offer to the advocate who is supporting other patients is empowerment. And I can't overemphasize the word empowerment. Because for you to support others, first of all, you need to know, you need to have the skills, you need to have the knowledge. And with the theme of this meeting, the evolving role of the patients, then the technologies are also evolving. The dynamics are changing on the way how healthcare is being delivered. That cause for empowering yourself, because the advancements have opportunities, but remember they also have the challenges. So as a patient advocate, you need to know, and you're better able then to support the people that you're leading. But of course, working together, co-creating solutions together.
Thank you so much, Regina. Aviva?
Yeah, well, I am going to share the best piece of communications advice that I have ever got. Okay, you ready? It all is rooted in success, or the acronym SUCCESS. And that is what's going to make your ideas and your messaging stick. Okay, these are 6 rules for good communications that have changed the way at least I communicate at Pfizer. The first S stands for keep it simple. You have, according to studies, 9 seconds to grab someone's attention before you have, the opportunity to lose them. 9 seconds. So you got to keep it simple and you got to keep it short. For unexpected, you want to offer them a hook. You have to surprise them perhaps, but start the story with something that really pulls them in. C is for concrete. You want to share specific examples, and you need to repeat these examples. Studies show that 20 minutes after someone hears something, they forget a majority of what they just heard. You have to repeat your messages for them to stick, no matter the audience. The second C is for credible. Which sources are you citing? Are you referencing sources that people can access and understand and turn to in the future? E, emotional. You have to appeal to someone's emotion. You have to get them to feel the impact of the story that you're sharing, and that is what will inspire them to action. And finally, our last 2 S's are for stories and for stories, because stories, as we've heard over and over again today, are really, it's our opportunity to build community, to create connection. And it's how you as advocates can get the very, very necessary and important work that you're doing out into the world. So keep in mind, success makes ideas stick. Thanks.
Thank you so much, Aviva. Thank you so much, Aviva, Farida, and Regina, for this really important discussion we just had. And I'd like to turn it over to anybody in the audience who has any questions for us.
I have a question to Aviva. I agree with what you said about the power of stories, but what would your advice be if I encounter a mother who heard an equally impressive story about a kid who allegedly was harmed after being vaccinated?
That's really hard. I think that in that example, it's important to combine the personal story with the larger story of public health, right? When we tell the story of the health landscape, we can think of telling the story of how vaccines have, dramatically decreased the impact of a disease on a population and sharing that high-level story. but kind of also acknowledging that mother's pain is very important, but bringing it back up to the story of public health, the high level information of how vaccines have supported the vast majority of people, and that patient might have been within a minority. That's a great point. Yeah.
Thank you so much. Next question.
My name is Rita. I work for the South African Cystic Fibrosis Association, and I'm on the rare diseases team as well. So I think in Africa and South Africa, and this is where I need advice, how do we tell the stories? Because our patients don't have access always to the internet, which is the easiest way. So have you found any way and means that are more effective to speak to our rural patients?
Perhaps I can.
It's a similar question to her. My name is Rebecca Chirenga. I'm a patient advocate from Zimbabwe. I work for an organization, a women's organization, and we've been, we talked a lot about, they talked a lot about health education and co-creating solutions. The access, like she rightly says, to this information is very limited because of language, the technical jargon, and the lengthiness of the information that we give them. How best can we do this to reach that rural woman who's got a child that needs a vaccination, that child that needs clinical trials, you know, all sorts. How do we get that information through to them? Thank you.
And perhaps I can start before I turn it over to any one of the panelists here, is that, you know, the first most important thing is to really meet the patients where they are. So a lot of the times you have to look at the patient and really think that who do they go to for trusted information? And maybe, you know, the sources of communication, this might be, how do they get their information? Is it from the community leader? Is it from radio? How do they really get this information? And then meet them where they are and make sure that we're translating what we're doing for the local needs of the patients and of that local community.
Yeah, I think pretty much the same. Meeting them where they are and also using the appropriate approaches that are appropriate to the community. I liked Candace's way of, dancing. We use a lot of music, dance, and drama. And that actually is very, very impactful. And we have actually started the Start Early initiative using the young children so that we inculcate the culture of safety early enough. But again, these young children also use the drama. We use them to use that drama, presenting to their guardians during performances at school, and also bringing them to our World Patient Safety Days. And it's amazing how that is working. So using the appropriate approaches, tailored to the communities we serve.
Thank you. Did you want to add anything before we move to the next question?
Yeah. So that's a very good question that you've asked. And that's one of the areas that one of the challenges that we're looking to bridge. And how we're doing this is through the advocates as well. For example, in Tanzania and in Swahili-speaking countries, the This Is Living with Cancer app is actually in Swahili. It's not in English. So we are trying to tailor the innovations that we come up with to suit the patient that we're trying to reach. In terms of the information and the jargon, the scientific content that may be present, I totally agree with you. We have received this feedback. And so we try to sit in advisory boards with patients just to say, this what doesn't make sense for me. This doesn't make sense for me. Can you simplify this? And so this is why co-creation is very crucial going forward in changing health outcomes and also improving the way we communicate with our patient communities. So I hope this helps.
I just have one really quick example. I promise. I found it so fascinating. There was a group in rural India that also was struggling without internet access. And they were trying to solve for the problem. How do we talk to young women about period education. There was a big cultural barrier, and women did not feel comfortable talking to their moms about sanitary napkins or how to take care and manage their menstrual cycles. So this community group, and I'm kicking myself for forgetting their name, but they created a zine, a small magazine from printer paper, and they created a storybook of a little girl named Anjali who just got her period, what she did, who she talked to. They made it a beautiful story, and they put the zines out in their schools. And that was such a creative example of using stories, reaching people where they are, getting education across in a way that will meet that particular person. I'm going to remember the name and I'll share it with anyone who wants to know.
Thank you. Do we have enough time for more questions? One more? Last one. Okay, sorry.
Thank you very much for your generosity. My name is Shinichiro. I'm from my country, Japan, and I work in hospital, and I work in a foundation on healthcare delivery and hospital accreditation. I'd like to share my observation, and I'd like to ask panelists for your comment on my experience. I have been running National Reporting and Learning System. I have been running investigation system for birth injury in the foundation. And in my hospital, I have been running patient safety audit committee in the presence of patient representatives. In the initial couple of years, patients are all ignorant of how the healthcare is delivered, how the procedure is assessed. But as time goes, with the help of other members, other experts in the committee, they learn how to evaluate the procedures, how the healthcare is delivered. So it's sort of an on-the-job training in spite of the learning in existing course in university or existing course provided by some research institutions. So I realized that the value of on-the-job training by including patient in our committee. So I'd like to ask you, panelists, for your comment on my experience.
First of all, congratulations.
Yes. Oh, thank you.
Congratulations for realizing that really at the end of the day, when you're delivering healthcare and you want to improve outcomes, those outcomes are for patients. So like everyone have said before in the different panels is how can we do this without listening and learning from patients and embedding their perspective across everything we do? And it sounds like you've been successful in that in terms of you've seen that it's hard maybe in the beginning, but once you embed patients in that perspective, it really improves the way healthcare is then delivered within the hospitals. So I'd say thank you and I commend you. And then how can you continue to reach out and teach and really share this with other health systems or hospitals within Japan? At least that's my observation. I'm not sure if Regina or anybody else has anything to add. The same? Okay.
Okay.
All right. Thank you.
Great. Thank you. Thank you very much.
Over to you, Carla. Thank you.
Thank you all. Thank you, Emma, for this amazing panel. Advocates around the world are asking their governments to be involved in co-creating these policies. Always, we are asking our governments, call me, this motto, nothing about me without me, includes us, but this creates a big responsibility. Be prepared. Use this tool to be the voice of your groups, be the prepared voice to bring the message, to have a correct storytelling and to achieve the goals. So as one of the panelists said, together we can achieve a lasting and positive impact. Now I know you are a little bit tired, so I think this was an amazing panel. I just invite you please to a group photo. I don't know, Hussein, if everybody comes here or we put there, no?
Well, it's quite, we wanted to have a picture taken outside where it's very windy out there. So we are going to the ground level at the reception. So we are having our conference group photo. So I request all of you to please join us at the reception. And then, it's lunch as well. And we will reconvene exactly at 2 p.m. So first of all, let's go for the picture. Thank you very much.
Thank you again, Emma and the panelists. Thank you all.